Hello and welcome to A Sound Constitution here on CHLY 101.7 FM, a show where we focus on health topics important to our community. This year's team is made up of 8 third-year VIU nursing students. Our goal is to demystify health issues and address common misconceptions by sharing evidence-informed information from a variety of reliable resources. All information provided on our show will be available in our show notes on our Facebook and Instagram pages. We want to remind our listeners that the information presented in this show is for educational purposes only and does not replace the advice of your primary healthcare professional. If you have any questions or concerns about what's being discussed, feel free to reach out to us on Facebook at A Sound Constitution, Instagram at CHLY A Sound Constitution, all one word, Twitter at ASC_VIU, or email us at asoundconstitution@gmail.com. We would like to start our show by acknowledging that we are in the unceded territory of the Snuneymuxw people, with a broadcasting range that overlaps the Cowichan and Sliammon territories. This acknowledgement is done with gratitude to the Snuneymuxw people and with the intention to increase awareness about truth and reconciliation processes and efforts on Vancouver Island. Additional information and resources surrounding Snuneymuxw history, reconciliation, protocol, and land acknowledgement can be found on our Facebook, Instagram, and YouTube pages. Welcome to this week's episode of A Sound Constitution. I'm your host Lauren, and here with me today are my co-hosts Jamie, Nicole, and Luke. We have an exciting episode for you this week because today we're talking about sleep health. Are you someone who suffers with insomnia, trouble falling asleep, or staying asleep? Have you ever been told you snore? How about sleep apnea? Are you curious about what it is and why so many people seem to have it? Or are you someone who doesn't currently have issues with sleep, but want to improve things like your cognition and mental health? My colleagues and I have prepared a wealth of information presented in short segments that demystify and inform more about sleep and offer helpful tips that are proven to help improve sleep quality. Coming up, all this and more, so sit back, get cozy, and hopefully this episode will help you get more out of your sleep. First up on the show is a short introduction to sleep from a YouTube video created by the Sleep Foundation, written by Eric Suni and Dr. Abhinav Singh, a sleep medicine physician. It provides a simple introduction to what happens to our bodies while we sleep and the stages of sleep. For more information, you can find this clip in our show notes that will be available right after this episode.
Every night you probably get into bed, wind down, close your eyes, and that's it. And then you wake up and it's a new day. But what happened during those 8 hours? Did your body and brain shut off? Or is there something more going on? How does sleep work?
Hi, I'm Faith from Sleep Foundation. It's easy to think that when we fall asleep, we're slipping into a uniform state of passive rest and sedation. But sleep isn't just one thing. It's actually a multifaceted and very active process broken up into 4 stages, each with their own goals and objectives. First, there is that hazy period right when you start to fall asleep, and you don't really know the difference between being awake and being asleep. This is called N1 sleep, and it lasts anywhere from 1 to 5 minutes.
Next, you enter the N2 phase. This is where your brain activity slows
down along with your heartbeat and respiratory rate.
This stage can be as short as 10 minutes, but as long as an hour. The next stage is called N3, also known as deep sleep. The brain activity during this period has a pattern known as delta waves, and this stage is critical to restoring your body and mind. This delta wave activity processes your memories and experiences from the day, while your body releases growth hormone to repair muscle tissue, regrow bone cells, and strengthen the immune system. Finally, you enter N4, the famous rapid eye movement or REM sleep. During this stage, your brain is almost as active as it is when awake. There is evidence that REM sleep contributes to insightful thinking, creativity, and memory. This is also the stage of sleep when you have the most vivid dreams. But dreams are more than just a series of surreal images. They serve as kind of a mental housekeeping to clean up partial or unnecessary information. These 4 stages repeat in about 90-minute increments throughout the night. Depending on how long you sleep, your body may go through this cycle 5 to 6 times in an evening. This complex and multi-stage cycle is known as your sleep architecture, and it's the basic structural organization of sleep. So look, it's easy to think you're just resting when you fall asleep, but there's so much more going on, as complex processes are at work, restoring your body, cleaning out your brain, and preparing you for the day ahead. Thanks for watching, everyone. Sleep well.
That was How Does Sleep Work and Why Do We Need It?, produced by the Sleep Foundation. Now we know a little bit about why we sleep, let's take it a little further. All humans need to sleep, but as a society, we don't value sleep as we should. Dr. Michelle Olathe is a practicing psychologist who researches sleep disorders, mood problems, and brain dysfunction at the University of Western Australia, School of Psychological Science. Her TED Talk touches on research behind sleep, what happens when we're deprived of sleep, how it affects our mental and physical health, and how to sleep ourselves well.
In 1964, Randy Gardner, some college friends, and a university professor, Professor William Dement, decided to go for the world record of days without sleep. After day 2, Randy could barely hold his eyes open, and he couldn't repeat simple tongue twisters. His friends were falling asleep, leaned up against the wall. By day 3, he was uncoordinated and moody. By day 5, he was hallucinating. He managed to make it to 11 days and 25 minutes before he was rushed to the local naval hospital, where he spent for the first night 14 hours of sleep and spent the majority of that time in deep and dreaming sleep. These are your restorative sleep states. Moving on to other research, Williamson and Fayer show us that if you spend around 15 to 19 hours deprived of sleep, you will behave as if your blood alcohol level is 0.05. That's drunk. Your reaction times will be 50% slower, and your accuracy will be abysmal. If I got you drunk and I gave you your keys, would you drive home? At the end of a long shift at work, if I gave you your keys, would you drive home? Now, in one of these situations, you're going to be arrested, and in the other situation, you'll be thanked for your time and paid. The answers to these questions tell us a lot about how we as a society value sleep, and as individuals, how we value sleep. We know from the research that if you don't get around 7 to 9 hours on average of sleep per night as an adult, it's going to impact your mood, your health, increase your accident rates, and it's less likely that your marriage will work out. The relationship between sleep and mental health is intimately and bidirectionally intertwined. Traditionally, we thought that if you had sleep symptoms, it was a symptom of your mental health problem. However, we now know that poor sleep wreaks absolute havoc on your neurotransmitters and your stress hormones, making it really hard for you to think straight and for you to maintain a good mood. The stats on sleep and health tell us exactly the same story. If you have disturbed sleep, you're more likely to have a cardiovascular event, get diabetes, get cancer, and if you're an undersleeper, that's a person who sleeps for 6 hours or less, or an oversleeper, that's a person who sleeps for 10 hours or more, you're at a higher risk of all-cause mortality. We are not going to work ourselves to death. We're going to wake ourselves to death. However, each night, all of you hold a key, a magical pill to help you rewire and heal your brain. Even Randy Gardner held that key. Because when Randy went to sleep and he spent the majority of his time in deep and dreaming sleep, he was healing. During deep sleep, you open up your brain's dedicated waste clearance system. This is your glymphatic system. And this system, made up of all these beautiful little glial cells that kind of look like stars, pulse with your cardiovascular system at night time. The point to this system is to wash the metabolites out of your brain and bring fresh supplies in so that you can work well the next day. We know that in people where they have disturbed sleep or their lymphatic system can't work well because of cardiovascular problems or older age, we don't wash these metabolites out of our brain so well. They build up in our brain, and it puts us at a 7 to 27% higher risk of cognitive dysfunction and of dementia in later life. But I say to you that you are waking yourself to death, but you can sleep yourself well. The other sleep state that Randy spent the majority of his time in was dreaming sleep. During the day, you process hundreds of thousands of events that prime synapses, those are the connections between your neurons or your nerve cells, that need further processing. When you go into dreaming sleep, your brain processes those prime synapses further, creating proteins and laying down long-term memories. The other thing that happens is that you prune away the synapses that you don't use very often, and that makes your brain more effective and more efficient. So what I want to talk to you about today are 3 locks on your sleep and 3 keys for you to unlock that, and you can start these changes tonight.
You are listening to The Science of Sleep with Dr. Michelle Oley on this episode of A Sound Constitution here on CHLY 101.7 FM. Now, back to our TED Talk on sleep.
Lock number 1, dirty bedtime habits. In the 1890s, there was a Russian behavioural scientist called Pavlov, and he took some dogs and some bells and some meat. And every time he'd ring the bell, he would present the dog with some meat, and that would make the dog salivate. With enough pairings of the stimulus, which is the bell, with the reward, the meat, he could make the dog salivate just by presenting the bell. You are an animal, and so you can train yourself behaviourally in this way as well. With enough presentations, clean presentations, of the bed with feeling sleepy, eventually the bed is enough to make you feel sleepy. But they need to be clean presentations. So that brings you to key number 1. Clean your routine. If you have a clean routine, your body learns. And your body learns to give you melatonin at night to make you go to sleep at the same time, and cortisol in the morning to make you wake up and feel refreshed. Now, when we're talking about the amount of sleep you get, we also want quality of sleep. Keeping that same routine is what gets you that quality. When you're creating this clean routine tonight, I want you to think about babies. If you want your baby to sleep, you're going to do the same thing every day by routine. You're going to give them a light and fairly satisfying meal, and then you're going to give them a shower or a bath because that's going to help drop their core body temperature, which is one of the things that we do when we go to sleep. Then you're going to read them a book and take them to a room where it is dark and comfortable and quiet and cool, around 19 to 20 degrees Celsius. And you're going to repeat this pattern because anyone who's had a baby knows that if the baby sleeps well, you sleep well. So you need to think about yourself in this same way. If you treat yourself with the routine like you would a baby, you will also sleep well. If you take nothing else away from this talk today, I want you to keep the same wake-up time, because the research shows us that is the critical thing you need to keep exactly the same, with about a half-hour change either side to make sure that you sleep well with good quality. That takes us to lock number 2. Lock number 2 is overthinking. Overthinking is not great for your sleep. And that's because of how our brain operates at night time. We are a diurnal species, that means we're awake during the day, and we're built to be asleep at night time. So at night time, your executive functions, this is a system in your brain that's responsible for problem solving and for directing your attention, shut off. And your default mode network, this is a network inside of your brain that's responsible for things like daydreaming and self-reflection. That turns on. With this pattern of turning off and turning on, unfortunately, you cannot trust your thinking at night time. We know that from statistics, we have a much higher risk, or people who are at risk of engaging in self-harm or suicide behaviours are going to do it at night time. And one of the contributing factors is this pattern of things that turn off in our brain and things that turn on. You cannot trust your thinking at night time. Tell me this, has anyone had the experience at night time where you wake up in the middle of the night with an absolute aha moment? Yeah? Or thought, oh my gosh, absolute disaster, only to then wake up in the morning and realise it was complete waffle? Yeah? I think most of us can relate to that experience. That is you experiencing parts of your brain turning off and parts of your brain turning on. So that takes me to key number 2. When you go to bed, put your thinking to bed. Now, I'm going to say that, and then there's going to be a lot of people in the audience that are thinking, that's not as easy as you've said it to be. But you will all be familiar with this non-pharmacological, non-invasive technique that is actually fabulous for helping you direct your thinking to where you want it to go. And that's called meditation and mindfulness. Now, this has come out of the realm of the esoteric, and we now know from research that if you practice this for 15 minutes a day, you will get the health benefits, and also you will develop a thing called meta-awareness. Meta-awareness is the capacity to think about your thinking. Mindfulness and meditation, if practiced, is a bit like your weightlifting for your brain. Now, you remember I said your executive functions go off and your default mode network goes on. If you practice mindfulness and meditation, you're able to catch this mind wandering and bring your brain back to where you want it to be focusing on. Mindfulness and meditation are the antithesis to mind wandering at night time. So lock number 3. Lock number 3 is your technology is too smart for your biology. Now, most of you will have one of these beautiful little devices in your pocket or in your handbag. I have no doubt a lot of you probably take them to bed with you. They come in around that kind of shape, and they allow your boss to come into your bedroom with you at 9 o'clock at night and tell you that the Friday deadline that was due for Friday is now due tonight. They tell you that your best friend can come into your room at 3 a.m. in the morning and say that they've made the most amazing cheese toastie. This is fantastic because it means that we've got our friends and our bosses and everyone's so available. It's not great for your sleep, unfortunately. There's 2 theories on why this might be the case. The first theory is that the content on these devices is incredibly stimulating or stressful. And you'll remember that I said that one of the hormones you release to wake up is cortisol. If you are stimulated or stressed, one of the hormones that you will release is cortisol. So simple, not great for sleep. The other reason, and the evidence is a little equivocal for this one, is that the wavelengths of light on these devices is blue light. And so that means it's the same wavelength of light as you get exposed to during the day. That light goes in through your eye to your suprachiasmatic nucleus. There'll be a test on this at the end. And that is your master clock. The suprachiasmatic nucleus resets your entire body clock to say it's daytime. Again, not so great for sleep. So that brings us to key number 3. Key number 3 is at night time, put the tech down and let your biology do its job. If you want to sleep well, you need to have good boundaries around your tech use. And this goes for you and your kids as well. The research shows us that if you allow your kids to have free rein on their devices, they're going to push their bedtime back, they're going to want to wake up earlier in the morning, and they possibly will have a higher risk of mental health problems as well. So about 2 hours before bed, devices need to go away. And for yourself, be a role model at work. Call a work meeting. Say that you went to a TEDx talk on sleep health and you now want to be the sleep health advocate at work. Make sure that there are work boundaries. No emails after 6, nothing on the weekends. Be a role model. Because we know that if you want to work hard, you need to rest harder. So that gives us 3 things for good sleep. The first is clean your routine. The second is that you need the overthinking is the enemy for sleep. Meditate. The third is put the tech down and let your biology do its job. I've said to you that we are waking ourselves to death. But let's all start tonight to sleep ourselves well.
That was a TED Talk from Dr. Michelle Olathe from the University of Western Australia. To find out more about her work, check out our show notes posted on our Facebook and Instagram pages. Speaking of sleeping ourselves well, what happens when there's something preventing us from getting a good night's sleep? Up next, my co-host Luke with a segment on snoring.
Sound familiar? According to the Canadian Otolaryngological Society, of all the normal Canadians adults who will fall asleep tonight, 25% of them snore habitually, and a larger 45% of adults will snore at least occasionally. Given its prevalence, almost everyone knows what snoring sounds like, but how many of us know exactly what causes snoring? Before we dive into this topic, a note to our listeners that all of the following information has been authored by Healthwise Incorporated and can be found on healthlinkbc.ca.
Furthermore, a uvula is the little dangling piece of tissue in the back of your mouth, and adenoids are tiny glands that hide behind the uvula.
So without further ado, let's get into it. When you sleep, the muscles in the back of the roof of your mouth, known as the soft palate, along with the tongue and throat, all relax. If they relax too much, they narrow or block your airway. As you breathe, your soft palate and uvula vibrate and knock against the back of your throat. This causes the sounds you hear during snoring. Furthermore, the tonsils and adenoids may also vibrate. The narrower the airway is, the more the tissue vibrates, and the louder the snoring is. It's important to point out that the following information is about simple snoring. If you stop breathing, choke, or gasp during sleep, you may have a problem called sleep apnea. So what increases your chances of simple snoring while asleep? Well, allergies, congestion, smoking, alcohol consumption, obesity, sleeping flat on one's back, jaw abnormalities, age, snoring is most common in middle age, and sex. Men are more likely to snore than women. All of these factors impact the likelihood that one will snore. With that in mind, can snoring cause us any harm? Well, most common is the compromised sleep quality for both you and those around you. However, snoring that affects how well you sleep may also increase your risk of high blood pressure. As we mentioned above, it's also important to point out that snoring is the main symptom of sleep apnea, a serious medical condition. Call your doctor if you or your bed partner snores loudly and heavily, snores and feels sleepy during the day, snores and falls asleep at the wrong times, such as when talking or while eating, stops breathing, gasps, or chokes during sleep. What to do if you think you are experiencing simple snoring, though? Snoring is often treated successfully by making lifestyle changes. As an act of initial and ongoing treatment, you can lose weight if necessary, go to bed at the same time every night and get plenty of sleep, sleep on your side, not on your back. You could even try sewing a pocket in the middle of the back of your pajama top and put a tennis ball into the pocket. This will help you keep from sleeping on your back. You could also avoid using alcohol and sedatives before bed. Quit smoking. Raise the head of your bed 10 to 15 centimeters by putting bricks under the legs of the bed. If you simply use pillows to raise your head, it will not work. You can promptly treat breathing problems, such as a stuffy nose caused by cold or allergies. You can also use a nasal dilator to help keep your airway open. This is a device, such as nose strips or discs, that you attach to the outside of your nose while you sleep. If snoring continues despite these treatments, continuous positive airway pressure, or known as CPAP, or a surgery may be tried. Implants that stiffen your palate can help reduce snoring and the daytime sleepiness it causes. But snoring is not always considered a medical problem.
Uvula.
So find out if your provincial health plan or private insurance covers the cost of treatment. Thank you so much for listening.
Thanks, Luke. Listening to that was the opposite of a snore. To expand more on the anatomical aspect of snoring, here is a clip from Dr. Daniel Slaughter, an ear, nose, and throat specialist.
Patients frequently present to the office with a complaint of snoring. Although they may have tried many different forms of therapy to improve it unsuccessfully, they really don't know what's causing the snoring in them or what kind of causes it in general. There's actually 5 common causes of snoring. Anatomical blockage of the nasal airway is the primary driver of snoring for most patients. The second most common cause is enlargement of the tongue. Actually, the tongue will enlarge as a response to the nasal blockage because as we mouth breathe, the tongue will respond by progressively and irreversibly expanding. If the patient has disrupted sleep quality because of a blocked nose and enlargement of the tongue, it does produce less quality deep sleep, which alters their metabolic hormones, cortisol, growth hormone, insulin, and testosterone, which creates centripetal waking in the face, neck, and belly, and that will further accentuate their snoring. In some individuals, the soft palate and uvula will actually get stretched longer, and the long uvula is also producing a significant amount of snoring. Those patients will report a swollen uvula when they wake up in the morning. And rarely in adults, the tonsils themselves can be large. That's more of a problem in the pediatric population. In an ideal situation, a person has a wide open nasal airway, and the airflow will tend to be very soft and non-turbulent. If there is restriction of the airway, anytime you force flow through a narrow opening, it makes the flow faster and more turbulent, like putting your thumb over a garden hose makes the water come out faster. Rapid and turbulent flow will reach the back of the throat and produce vibration of the soft palate and uvula and snoring. It also produces a negative pressure to pull the tongue back into the airway. If they open their mouth, the open mouth position further facilitates the jaw and tongue to fall back into the airway, accentuating the snoring, and the tongue may become larger over time. Everything we do to improve the cross-sectional diameter of the nasal airway will reduce the forces that produce vibration and snoring and allow the patient to sleep with a closed mouth position. If we've made that ideal and the patient still has some snoring issues, the addition of an oral appliance to pull the oversized tongue forward will further reduce the snoring complaint.
That was Dr. Slaughter, a board-certified specialist in otolaryngology and sleep medicine by the American Board of Otolaryngology. You're listening to A Sound Constitution on CHLY 101.7 FM, a show produced by 8 VIU BSN students. Our goal is to demystify health topics that are important to our community. Thank you for listening. Throughout our show today, there's been mention of a condition called sleep apnea. What is sleep apnea, and what do we need to do if we think we have it? Here is my other co-host Nicole with the answer to this and more.
Hello listeners, this is Nicole. We are exploring a topic that disrupts the peaceful slumber of many, sleep apnea. This condition goes far beyond simple snoring. It serves as an important indicator of our health during the quiet hours of the night. We'll delve into understanding what sleep apnea is, identifying its symptoms, understanding the risk it carries, and what you should do if you think you might be affected by it. So what exactly is sleep apnea? It is a common yet potentially serious sleep disorder where breathing stops and starts during sleep. The most prevalent form, obstructive sleep apnea, occurs when the throat muscles excessively relax. Central sleep apnea, less common, happens when the brain doesn't send the right signals to the muscles controlling breathing and is characterized by a complete cessation of breathing and usually occurs in those with neurological conditions or is associated with substance use. It is estimated that 5.4 million Canadian adults have been diagnosed with sleep apnea, according to Statistics Canada. The term apnea means without breath, so when we say sleep apnea, we are referring to pauses in breathing that happen during sleep. These episodes can span from 10 to 30 seconds in duration. Imagine this: you're asleep, your body's at rest, but unbeknownst to you, your breathing stops repeatedly throughout the night. In obstructive sleep apnea, this happens because the muscles in your pharynx, or throat, mouth, and tongue relax too much, which narrows the airway, completely blocking airflow into the lungs. The lack of oxygen to the lungs wakes you up, sometimes causing a gasp for air before falling back asleep. This cycle can happen repeatedly over the course of the night, disrupting the ability to achieve deep, restorative sleep. During each episode of apnea, oxygen levels in the blood decrease, and the pattern of sleep is interrupted because the individual must awaken briefly to start breathing again. Typically, the person doesn't awaken completely and has no memory of these disruptions. And how does our body react? The drop in oxygen triggers your brain to momentarily wake you up to reopen the airway. You gasp for air, maybe choke, and then back to sleep you go, often with no memory of the incident. But these episodes, they're not rare occurrences. They can happen dozens, even hundreds of times each night, fragmenting your sleep and preventing you from reaching those deep restorative stages that are so crucial for your health and well-being. Certain risk factors increase your risk for developing sleep apnea and encompass a range of lifestyle, anatomical, and genetic factors. Obesity greatly increases the risk of obstructive sleep apnea as fat deposits around the upper airway can obstruct airflow. Males are 2 to 3 times more likely than women to have sleep apnea. However, the risk for women increase after menopause. Age plays a factor as it is more common in adults than children and generally over 40 years old. Having a family history may increase your chances. Using alcohol or sedatives increase your chances as they relax your upper respiratory muscles, making sleep apnea worse. Smokers are also more likely to have obstructive sleep apnea than those that don't smoke. So how do you recognize the signs of sleep apnea? Symptoms range from morning headaches to daytime sleepiness, irritability, poor concentration, and lowered sex drive. Often, a bed partner will notice signs first, observing loud snoring, choking sounds, restlessness, or that you stop breathing. It is important to note that snoring alone doesn't indicate sleep apnea. It is true that almost all people that have sleep apnea snore, but not all people who snore have sleep apnea. Untreated sleep apnea is a silent catalyst for a cascade of health issues: hypertension, heart disease, stroke, diabetes, and even depression. Excessive daytime sleepiness can lead to the risk of motor vehicle accidents and work-related injuries. The intermittent oxygen drops, the fragmented sleep, it strains the heart, pressures the vascular system, and clouds the mind. It's a condition that silently chips away at one's quality of life, yet it's often lurking undiagnosed, with an estimated 80% of cases going unnoticed. If any of this sounds familiar, it's important to consult a doctor. They will assess your symptoms and your sleep history and likely refer you to a sleep disorder clinic for a sleep study, or recommend doing one in your home. An evaluation involves a polysomnogram, which is an overnight sleep study in which they hook you up to equipment that monitors your brain, heart, and lung activity, your oxygen levels, and muscle movements. The test is looking for how often you stop breathing, how little air might be flowing into your lungs, and how much oxygen you have in your blood while you sleep. This study is key in determining the presence and severity of sleep apnea. Treatment can vary based on the severity of the condition. Lifestyle changes like losing weight or changing sleep positions may be effective for mild cases. Quitting smoking, avoiding alcohol and sedatives before bed, and engaging in exercise are also effective ways to treat mild sleep apnea. An interesting study out of Switzerland by Milo et al. Showed the efficacy of playing the didgeridoo in reducing obstructive sleep apnea, as it helps strengthen the upper airway. If you ever wanted to learn a new instrument, what better reason than this? I'll link the article in our show notes. Yawning, singing, and tongue exercises are other ways in which you can strengthen these muscles to reduce mild sleep apnea and decrease daytime sleepiness. I'll link these articles in the show notes as well. For more severe cases of apnea, a CPAP, or continuous positive airway pressure machine, which uses pressurized air to keep your airway open during sleep, is often recommended. A CPAP is a medical device that blows pressurized air through a mask and is worn over the nose or the mouth and nose and blows air into the airway to keep it open while you sleep. This allows you to receive the oxygen you need to function and improve sleep quality and reduce your risk for those health issues mentioned earlier. I hope this segment enlightens you on the importance of addressing sleep apnea and encourages those affected to take action. Just a note that all information referenced in this segment will be linked in our show notes on Facebook, Instagram, and on our YouTube page. Thanks so much for tuning in, and here's to healthier nights and brighter days ahead.
Thank you, Nicole, for your fantastic segment, and also your thorough research into demystifying the topic of sleep apnea. Sleep paralysis. Is that a real thing? What exactly is it? Sleep paralysis can be a scary experience, but this clip helps clear some of the fear and confusion surrounding the strange phenomenon. The clip explores what sleep paralysis really is, its biological cause, and also presents some tips to help prevent sleep paralysis. This clip is from a video produced by McMaster University Faculty of Health Sciences.
Imagine you are just about to fall asleep, and you start to count sheep in your head, when all of a sudden you feel a pressure on your chest and you sense a presence in the room. You cannot move a muscle, but you can see your surroundings and are awake and alert. This is sleep paralysis. Sleep paralysis is a momentary alertness but loss of voluntary muscle movement that occurs when you are just about to fall asleep or when you are just waking up from sleep. It can last anywhere from 20 seconds to a few minutes, and it affects about 8% of the general population. Some of the common sensations and emotions associated with sleep paralysis are an awareness of your surroundings but inability to move, a sense of physical weight and pressure on the chest, difficulty breathing or a choking feeling, hallucinations or a sensed presence, and an overwhelming sense of fear or dread. Some people even describe hearing footsteps getting closer, seeing intruders, demons, or spirits, and feeling as if they are about to die. Although there is no physical danger to the person experiencing sleep paralysis, they cannot pull themselves out of it and must wait for it to pass. Sleep paralysis is different from nightmares or night terrors in that the brain is awake but the body is in its sleep state and thus cannot move. What is most interesting about sleep paralysis is that it dates back to the 10th century and is prevalent in all ethnicities. In fact, people from many cultures have used sleep paralysis as a way to explain supernatural events and beings, such as witchcraft, ghosts, and alien abduction. Now, let's go into detail of what sleep paralysis really is. There are two types of sleep paralysis, hypnagogic and hypnopompic. These two terms refer to the difference in time at which sleep paralysis occurs. Hypnagogic, also known as predormital, is when sleep paralysis occurs at sleep onset or just before falling asleep. On the other hand, hypnopompic, also known as postdormital, refers to sleep paralysis that occurs just after waking up, at the transition from sleep to awakening. In order to understand how sleep paralysis occurs, we have to understand what REM sleep is. During sleep, your brain cycles through 5 different phases: Stage 1, Stage 2, Stage 3, Stage 4, and Stage 5, which is called Rapid Eye Movement Stage, or REM for short. A REM sleep cycle consists of 25% of your sleep, which may occur several times throughout the night since your sleep cycle is repeated. REM is important because this is when dreaming occurs and when your body becomes energized. During REM, signals are sent to your spinal cord and motor neurons to shut off movement, creating a temporary inability to move the muscles of your arms and legs. This serves as a protective measure to prevent you from injuring yourself or others while you dream. Now that we have an understanding of what REM sleep is, let's talk about its importance to sleep paralysis. Sleep paralysis is thought to occur due to an error in the flip-flop switch controlling REM sleep. REM sleep is thought to work as a switch between 2 stages: REM on, when REM occurs, and REM off, when it does not. This mechanism allows for smooth transitions into and out of REM sleep. This REM switch works in opposition to the wake-sleep switch. Normally, REM on occurs at the same time you are asleep. However, when sleep paralysis occurs, the neurons controlling the wake side of the wake-sleep switch and the neurons controlling the REM off side of the REM switch are weakened. This allows the REM on neurons to prevent muscle movement while the body is somewhat awake, which should not be happening. This can cause sleep paralysis. Experiencing negative emotions is another common occurrence during REM sleep. This is because the area of the brain known as the amygdala, which is important in fear processing, is active throughout REM sleep. Since it is active during REM and is closely associated with fear, it is thought to facilitate the generation of anxiety and fear during sleep paralysis. So, how do you avoid sleep paralysis? There are a number of factors that contribute to your likelihood of experiencing it. A twin study conducted on 862 participants showed that genetics are at least partially to blame for sleep paralysis, with researchers finding that genes accounted for 53% of the occurrence of sleep paralysis. If you have a sleep disorder, you're also most likely to experience sleep paralysis. Sleep paralysis is a common symptom of a sleeping disorder called narcolepsy, which is characterized by excessive and uncontrollable daytime sleepiness. Sleep paralysis is also most likely to occur if you sleep on your back and if you regularly don't get enough sleep. In general, poor mental health is associated with sleep paralysis. Higher scores on self-reported measures of depressed mood and anxiety have been associated with sleep paralysis. Research focusing on sleep paralysis in patients with PTSD showed higher prevalence as well, and another study has linked bipolar disorder to sleep paralysis. As we have seen, there are a number of factors associated with sleep paralysis, like genetics, poor sleep, sleeping disorders, and poor mental wellness. Aside from avoiding or treating these specific risk factors, are there other treatments that could work for avoiding sleep paralysis? Well, there is no universal treatment that works for treating sleep paralysis. There are preventative and management strategies. However, these strategies lack empirical consensus among researchers. Some researchers have suggested that treating underlying sleep-related disorders or mental illness disorders may help with preventing occurrence of sleep paralysis, and some pharmaceutical drugs, such as antidepressants, may help in managing sleep paralysis due to their REM-suppressing properties. Additional preventative strategies for sleep paralysis include having optimal sleep hygiene, avoiding alcohol and caffeine before bed, and incorporating pre-sleep relaxation practices into your nightly routine. Although experiencing sleep paralysis can be extremely frightful, there are no immediate dangers or health risks associated with it. We hope that you were able to learn something from this video, and we ask that you please subscribe to our Demystifying Medicine YouTube channel for more videos.
If you're just tuning in now, you're listening to A Sound Constitution on CHLY 101.7 FM. Next on our exciting lineup for this episode is my co-host Jamie, who will share about how shift work affects sleep.
Hello everyone, it's Jamie here again. I am going to dive deep into the fascinating and often misunderstood topic of shift work and sleep. It's an issue that affects millions of individuals worldwide, particularly those in professions like healthcare, transportation, and emergency services. Tonight we'll be exploring the ins and outs of shift work, its impact on sleep, the associated risks, long-term effects, and most importantly, practical strategies to help shift workers get the quality rest they deserve. All of the information I will be discussing is retrieved from the sleepfoundation.org, the Journal of Circadian Rhythms, as well as the Canada Post Shift Workers Handbook, which draws from reputable sources such as Health Canada, the Canadian Centre for Occupational Health and Safety, and other credible agencies. You can find these references available on our show notes. Shift work, as defined in the Shift Workers Handbook by Canada Post, encompasses a wide range of work schedules outside the typical 9-to-5 framework. It includes evening shifts, overnight shifts, and rotating shifts, all of which disrupt the body's natural circadian rhythm. Imagine a nurse working the night shift at a hospital or a truck driver delivering goods across the country while most people are asleep. These individuals face unique challenges in maintaining regular sleep patterns and often struggle to get the rest they need to stay healthy and alert. The consequences of disrupted sleep patterns, as highlighted by the Sleep Foundation's research on shift work disorder, extends far beyond feeling a little bit groggy the next day. Shift workers face an increased risk of various health conditions, including obesity, diabetes, cardiovascular disease, and certain types of cancers. Moreover, chronic sleep deprivation can impair cognitive function, leading to decreased alertness, concentration, and decision-making abilities, which can have serious implications for workplace safety and performance. Disrupted sleep patterns can also take a significant toll on mental health. Shift workers are more likely to experience mood disorders such as depression and anxiety, as well as higher levels of stress and burnout. The constant struggle to balance work and personal life, coupled with the sleep disruptions inherent in shift work, can leave individuals feeling overwhelmed and emotionally drained. Despite the challenges posed by shift work, there are several practical strategies outlined in the Shift Workers Handbook by Canada Post that individuals can implement to improve their sleep quality. One of the most crucial steps is establishing a consistent sleep schedule, even on days off, to help regulate the body's internal clock. Creating a sleep-conducive environment by minimizing light and noise, investing in blackout curtains or white noise machines, and ensuring a comfortable mattress and bedding can also promote better sleep. Diet and lifestyle habits also play a significant role in sleep quality, making it essential for shift workers to pay attention to what they eat and drink, particularly close to bedtime. Avoiding heavy, spicy meals and stimulants like caffeine and nicotine before sleep can help prevent disruptions to sleep. Instead, opt for light, nutritious snacks and stay hydrated throughout the day to promote better sleep quality at night. Incorporating relaxation techniques into the bedtime routine can also help shift workers unwind and prepare for sleep. Deep breathing exercises, progressive muscle relaxation, and mindfulness meditation are all effective ways to calm the mind and body, making it easier to transition into a restful state. Experiment with different techniques to find what works best for you and make them a regular part of your nightly routine. Imagine a nurse who works long hours in a high-stress environment, caring for patients with critical illnesses. To decompress after a demanding shift, they may practice yoga to help release tension in their body and quiet their mind. They may also want to take a warm bath or listen to calming music before bed to signal to their body that it is time to wind down and prepare for sleep. Statistics gathered from the Shift Workers Handbook by Canada Post indicate that approximately 15 million Americans work full-time night shifts, rotating shifts, or other irregular schedules. For these individuals, navigating the challenges of rotating shifts requires careful planning and adaptation. Research from the Journal of Circadian Rhythms also suggests that gradually adjusting sleep and meal times in anticipation of shift changes can help mitigate the negative effects of circadian disruption. By gradually shifting bedtime and wake-up times by 15 to 30 minutes each day, leading to a new rotation, shift workers can minimize the shock to their internal body clock and promote smoother transitions between shifts. Furthermore, incorporating short naps of 20 to 30 minutes during breaks has been shown to improve alertness and cognitive function among rotating shift workers. Research from the National Sleep Foundation emphasizes the importance of creating a conducive sleep environment during daytime sleep periods. This includes investing in blackout curtains to block out sunlight and minimize disruptions to sleep quality. The Sleep Foundation has also found that exposure to artificial light during daytime sleep can interfere with the body's natural circadian rhythm and contribute to sleep disturbances. By creating a dark, quiet, and comfortable sleep environment, shift workers can optimize their chances of achieving restorative rest during daytime hours. Lastly, establishing a support network of friends, family, and colleagues can provide invaluable assistance in coping with the challenges of shift work. Do not hesitate to reach out for help when needed, whether it's for emotional support, practical assistance, or advice on managing work-life balance. By building a stronger support system, shift workers can navigate the ups and downs of their schedule with greater resilience and ease, ultimately improving their overall well-being and quality of life. As I bring this topic to a close, I want to leave you with one final thought. No matter how demanding your work schedule may be, never underestimate the importance of a good night's sleep. Thank you for tuning in, and until next time, sleep well.
Thank you, Jamie, for your great tips for shift workers to get better sleep. I know I'm going to bring some of those to my practice when I graduate. Jamie mentioned meditation and mindfulness to help wind down before bed. Some meditation apps suggested by the BC Mental Health and Substance Use Services are Breather, Insight Timer, Headspace, and Calm. All of these apps can be downloaded on iPhone or Android, and they will be listed on our show notes so you can learn more. So far, we've learned so many interesting things about sleep and our health. Now, how do we apply it in our lives? I invite you to listen to some practical and useful tips from this audio clip on sleep hygiene from BC Women's Hospital.
What's your sleep like? Do you use sleep hygiene strategies? What is sleep hygiene? It's trying to have habits that promote solid and consistent sleep. Everyone needs a good night's sleep. How do you know if you've had a good night's sleep? Let's start by keeping a sleep diary. For 3 weeks, keep track of your sleep. Each morning, jot down 1, how many hours you slept, 2, how quickly you got to sleep, and 3, how rested you feel. Don't judge your sleep, just keep track. If you're having sleep problems, it might predate your diagnosis of a complex chronic disease. But your sleep problems can worsen because of the disease that you're dealing with. We want to get to the root of your sleep problems. Let's figure out sleep together. What are the different stages of sleep? There are 5 sleep stages. Stage 1 is the beginning of the sleep cycle, moving from wake to sleep. It's really light, lasts for about 5 to 10 minutes. Stage 2, light sleep. This lasts for 20 minutes and your body is getting ready for deep sleep. The body temperature decreases and the heart rate slows. Stage 3 and 4. Sleep starts to get deeper here where the brain waves slow down. During this stage, the body repairs and regrows tissues, builds bone and muscle, and strengthens the immune system. Sleepwalking and nightmares can occur during this stage. Stage 5 is the name of the popular band from the 80s and 90s. Yes, REM sleep. The eyes begin rapid eye movement and the brain increases in activity. The body muscles stop moving temporarily. When REM ends, the body returns to stage 2 and then 1 and then wakefulness. REM sleep can last up to 1 hour. Most people experience 3 to 5 episodes of REM sleep each night. Vivid dreams are common during this stage, and one theory is that REM sleep may help the brain retain memories. There are 4 major issues that people can encounter with sleep problems. Number 1, initiating sleep. What can be the problems for this? A, they're wired. B, stressors. C, anxiety and worry. D, environment and stimulation. Number 2, maintaining sleep through the night can be problematic. If A, you're experiencing pain, B, bladder or menopausal issues, C, positioning and environment isn't great, or D, experiencing nightmares. Number 3, you're sleeping, but it's unrefreshing. If that's the case, then you are A, not getting to a deep sleep, or B, the fatigue and pain you have is not allowing you to get quality sleep. Number 4, some people experience a day-night reversal. We'll look to help you with this one. If you have chronic sleep problems, you may be referred to a sleep lab. They can check for nighttime seizures, periodic leg movement or restless leg syndrome, narcolepsy, which is daytime drowsiness and sudden falling asleep, and obstructive sleep apnea, which occurs when your throat muscles relax every so often and block your airway during sleep. A sleep specialist can help if you need further assessment or special equipment to help you sleep better. Many things can impact your sleep, like mood, depression and anxiety, menopausal symptoms, diabetes, heart disease, asthma, musculoskeletal pain, heartburn, kidney disease, thyroid disease. What can be done if you're experiencing problems in any parts of sleep? In the initiation, sleep promotion strategies, preventing wired and tired, eliminate that crashing, a structured sleep routine, relaxation exercises, and medications. For maintenance, there's pain control, manage bladder bowel issues and postmenopausal issues, deal with nightmares, manage environment, and medications. For unrefreshing, unrestorative sleep, we can help manage symptoms which will allow you to return to REM sleep. We can help you learn restorative activities to help activate the rest and relax part of the nervous system. For day-night reversal, we will help to reset the clock. Although medications and supplements are not the whole answer to improving sleep, it is important to know which ones help and which ones hinder sleep. We encourage you to speak to a doctor or nurse practitioner before starting or stopping any medications or supplements. Now that you know a bit more about sleep, it's important to complete your 3-week sleep diary. As you record details into your sleep diary, it is important to notice the relationship between your activity and rest patterns. This will help you to decide what changes you would like to make, like a set time to start your wind-down routine. When you have some goals in mind, we can take a look together and start to set up a plan that has achievable steps. We hope this video has not put you to sleep, but if it did, then consider watching it again when you're in the initiation stage of sleep. Just kidding. Watching TV or any screen time before bed can interfere with your sleep.
That clip was from BC Women's Hospital and can be found on YouTube. The link is in our show notes and will be posted after this episode. Thank you for listening to this week's episode of A Sound Constitution, and thank you so much to my co-hosts for their fantastic and informative segments this week. For details and show notes from today's episode, or to follow along on what's coming up this season, check out our Facebook page, A Sound Constitution, our Instagram, CHLY, A Sound Constitution, all one word, or our Twitter at ASC_VIU. If you've missed parts of this episode or would like to listen to this episode again, or episodes from our past shows, check out our YouTube at A Sound Constitution. Otherwise, we'll see you all next week.